Hello, everyone, and welcome to Becker's Healthcare 14th Annual Meeting, virtual event, and our featured session, No Wrong Door, Addressing Urgent Barriers to Contraceptive Care. On behalf of Becker's Healthcare, I am pleased to introduce our speakers for today. Dr. T and Kim are here from Upstream USA, a national nonprofit whose mission is to ensure that equitable patient-centered contraceptive care is basic health care. Upstream works to transform contraceptive care provisions by helping to bring contraceptive care into primary care through partnering with public and private healthcare organizations. They've partnered with over 150 healthcare organizations, such as federally qualified health centers, community health centers, state health departments, and large health systems. Kimberly Potter, MSW MPH, is the VP of Practice Transformation at Upstream USA. After earning an MSW and MPH from Boston University in 2006 and 2007, respectively, she has spent almost 2 decades working in community-based organizations as both a licensed social worker and public health practitioner, addressing issues including substance abuse, HIV/AIDS, mental health, homelessness, and health equity. Prior to joining Upstream in 2017, she led a quality improvement initiative through the NYC Department of Health and Mental Hygiene to support hospitals and healthcare facilities in the NYC area to address barriers to contraceptive care. Kimberly has received additional training through the Institute for Healthcare Improvement as an improvement coach and is committed to using these skills to improve healthcare systems and to address health inequities, particularly those that affect women and families. Dr. Angeline Ti is a clinical advisor at Upstream USA. She is also faculty at the Wellstar Douglas Family Medicine Residency Program in Douglasville, Georgia, where she works with residents to provide outpatient and inpatient family medicine. She also serves on the clinical committee of the Reproductive Health Access Project and as a guest researcher at the Centers for Disease Control and Prevention. Dr. T received her MPH at the Johns Hopkins Bloomberg School of Public Health with a focus in health disparities and her MD at the University of Michigan Medical School. She completed a residency in family and community medicine and also a fellowship in family planning at the University of California, San Francisco. Kimberly and Dr. T, thanks for being here today. I'll turn the floor over to both of you to get us started.
Thank you. Thank you for that introduction. And so I'll start by kind of setting the stage a little bit to talk about why contraceptive care is really just so important. And so as a family physician who specializes in reproductive health, I see every day how important contraception is at so many different points across someone's reproductive journey. You know, from teens who want to prevent pregnancy or maybe treat painful periods, all the way to women at the end of their reproductive journey who are done having kids or want to manage symptoms related to menopause. And as people's lives and priorities change and grow, their contraceptive needs also change and grow. And that's why it's essential that contraception is part of basic health care. But when it comes to contraceptive care, finding high quality, person-centered care still can be quite challenging. The current landscape for accessing contraception is a complex web with so many gaps. You know, starting off, people often think of OBGYNs as the place to go to get contraception. However, OBGYNs can be pretty hard to access. For example, the average wait time for a new patient appointment at an OBGYN is just over a month, which can be a huge barrier for accessing time-sensitive services. And I practice in a state where fewer than half of our counties even have an OBGYN. And so I also see that geographical access can be a huge issue in many parts of the country. And then once patients actually get in the door, they still might not be able to get the care that they need. And so despite being traditional providers of reproductive health care, actually only about 3/4 of OBGYNs and midwives provide contraceptive services. And while this type of care is absolutely within the scope of primary care providers, only about half of family physicians and less than a third of internists and pediatricians even provide any type of contraceptive care. So just finding contraceptive care is challenging. And unfortunately, we also see that the care patients are able to access isn't always that good. When it comes to quality of care, less than half of reproductive age women say that they receive excellent patient-centered contraceptive care, and less than a third say they receive enough counseling from their provider to make an informed decision about their birth control. And additionally, we know there's a maternal health crisis in this country. And where I'm practicing in Georgia, I really see this firsthand. And while delivering babies might not be within the scope of all, family physicians, all primary care providers, we also know that contraception is a crucial aspect of maternity care. And it plays a key role in helping women, parents, and families achieve their reproductive goals. And so this is where large health systems definitely have a huge opportunity to make an impact. Patients needing contraceptive care may enter a health system through a variety of touch points and at a variety of times in their lives. Right now, there are definitely patients in every health system around the country who are wanting to prevent pregnancy, are planning for pregnancy, or are navigating that complicated postpartum period. And so health systems have the opportunity to meet the contraceptive care needs at so many different moments in the lives of their patients. And so here at Upstream, we absolutely believe that there should be no wrong door to accessing contraceptive care, and that patients should have equitable access no matter where they are seen. But I'll also say, from the provider perspective, providing patient-centered contraceptive care isn't easy in our existing systems. Healthcare providers face a variety of barriers to meeting the contraceptive needs of their patients, including staff shortages and turnover, provider knowledge and training, navigating regulations and insurance, billing and stocking, and I could go on. But I'll stop here and pass it over to Kim to talk a little bit more about how Upstream can help organizations navigate these barriers.
Thank you, Angeline. As Angeline shared, this is really the reason that Upstream exists. We're here to help family medicine providers and the systems where they practice address these challenges and enable them to provide consistent, high-quality, patient-centered contraceptive care. So our team of operational experts really work hand in hand with your team to develop and implement a patient-centered contraceptive care model that not only can be maintained and sustained, it's also at no cost to you or your system to receive this type of support. This system means that patients can walk through any door, as Angeline said, and your team is prepared to identify those patients who may have an unmet contraceptive care need. They're able to counsel patients about their various birth control options, and then they can provide any services those patients may desire, ideally all within that same visit. We really work collaboratively with our partner health systems to design the right solutions for their unique challenges. We start off by assessing their needs and their strengths through a baseline assessment. And then we co-develop with you an implementation plan that meets the specific needs of your health system. Our work together can include developing standardized contraceptive care workflows that really begin with that routine screening of all patients' reproductive health care needs. And then it leads to really supporting a further understanding and defining the patient's contraceptive goals and educating them on their options. And then supporting patients to really develop a care plan that is right for them. And finally, managing any contraceptive provision if that's what the patient desired. We also support the development of a team-based approach to implementing that contraceptive care workflow. And we deliver an accredited role-specific training so your team has both the knowledge and the skills to deliver on exceptional contraceptive care. And finally, we leverage data measurement analysis so you can see how changes are impacting your patients and your clinical teams in real time. We worked with over 150 healthcare organizations across the US, and we've seen real significant impact in the practices just by making contraceptive care routine care. Patient-centered contraceptive care is a differentiator in healthcare. It leads to greater patient satisfaction with their providers and the care they receive, and it really supports patients to feel more engaged in their healthcare. And turn it back over to Angeline.
And so I'll also add that it can be tough sometimes for patients to open up and ask questions about their reproductive health, especially if they don't know if their providers are even comfortable with the topic. But when we, meaning providers, staff, clinics, when we open that door and invite those conversations, we really can better connect with our patients and build trust. When someone goes to see their PCP, they're presenting as a whole person, not just isolated parts or discrete problems. And so primary care really needs to be a space where we can have conversations about family planning and contraceptive care and how they really influence overall well-being. And I'll just end with a quick patient story. I recently saw a new patient who came into our office for her annual physical. And during this visit, she disclosed some severe mood symptoms that were associated with her menstrual cycle. And within that one visit, we were able to discuss how contraception could help treat her symptoms while preventing pregnancy as well. And we were able to start her on her preferred method that same day. And at least she seemed so relieved to have a PCP who could really take care of her and not just refer her out. Because in the end, contraceptive care is just basic health care. And so I'll stop here for some questions.
Great, thank you both so much. We'll get into the discussion questions at all. So the first one is for you, Dr. T. How do you define patient-centered contraceptive care and why is it important?
Thanks, that's an excellent question. So patient-centered contraceptive care is contraceptive care that prioritizes the individual patient's values, preferences, and really prioritizes their experiences as well. It's care that's trauma-informed and aims to minimize any bias or coercion. What this looks like in practice is a partnership between the patient and their healthcare team, where the patient brings their expertise about their lived experience and is truly heard by their providers. And the healthcare team brings up-to-date, evidence-based care and practices. And I think within this question, I'll also emphasize that contraceptive care is important because it is basic health care and essential to help patients prevent pregnancy, space pregnancies, and treat a variety of medical conditions. But patient-centered contraceptive care is especially important because historically, we have not centered the patient. And there are unfortunately numerous examples of bias and coercion where reproductive health care, especially within reproductive health care, especially perpetrated against women of color, which has led to really deep-seated mistrust. And so patient-centered contraceptive care is an important way to build trust and mitigate some of this harm.
Great, thank you so much. Kimberly, a question for you. In partnering with Upstream, what does success look like for hospital systems or clinics that you've partnered with?
Yeah, great question. So it can look in lots of different ways because we know that all hospital systems are different, they're structured different, they serve different populations, they may have different unique challenges. But really, I would say across the board in the hospital systems that we partnered with, successes look like embracing contraceptive care is routine primary care. Those systems who were successful really were able to recognize that while there was already access to contraceptive care available, maybe in certain clinics or in certain specific service line, they also were able to acknowledge that not all patients who needed that care may be showing up in those spaces. And this really led them to expand contraceptive care and access and really bring it to new spaces and new service lines like family medicine. Success also really looked like creating a standardized continuum of contraceptive care really throughout the hospital system, from primary care through prenatal and postpartum care, and then maybe returning to a primary care space. Patients knew that they could expect access throughout their hospital system. As Angeline said earlier, there's no wrong door, whether that was women's health, family medicine, or maybe even immediately postpartum, patients knew they could expect to receive that care throughout the system.
Great. And what should healthcare leaders focus on this year to promote access to patient-centered contraceptive care and the full range of contraceptive methods?
Yeah. So, when speaking with healthcare leaders, I think the first and most important thing they can do is really communicate out to their teams this vision and expectation that contraceptive care is primary health care. Setting that expectation really helps to start break down those silos that have really existed for so long when it comes to seeing reproductive and contraceptive care services being kind of the sole purview of women's health or OBGYN practices. I think the next thing they can really do is kind of take stock on contraceptive access across their system, really focusing on those primary care, family planning, family medicine service lines and practices, really identifying the range of care and access by site, identifying what those challenges and barriers are, and then thinking about what are your opportunities to increase access. And then really finally, I think they should begin identifying champions for contraceptive access. These are people who are really already in their system. These could be family medicine providers, nurses, administrative staff, maybe even medical assistants. These are really your change agents and leaders. These are the people who can really support your efforts to expand patient-centered contraceptive care across the whole system.
Thanks so much, Kimberly. And then another follow-up, what's exciting about Upstream's work to help ensure equitable access to patient-centered contraceptive care? Kimberly, we'll start with you, and then Dr. T, we'll pass it over to you as well.
Yeah, I think the thing that really excites me most is we really are moving into a place where contraceptive care centers the patients. It really focuses on patients defining what is the right plan for them and their families and getting the support to be able to sort of action on that plan.
I absolutely agree with that. And I'll also say what I'm excited about is being able to partner with organizations that really share our vision of, again, making contraceptive care basic health care. And then taking these partnerships and really being able to amplify this work and really, in the end, improving the quality of contraceptive care for people all over the country.
Great. Thank you both so much for your time, your vulnerability, and tireless commitment to helping increase access to patient-centered contraceptive counseling and care nationwide, as well as for sharing your thoughts on this presentation today. For the audience, if you would like to learn more about Upstream USA and how you can partner with them to provide high-quality patient-centered contraceptive care for your patients, visit upstream.org/LHS.